I'm super pumped about this because you got great energy about you.
Thank you.
And I feel like you're gonna really, we're gonna connect. That's for sure. But I mean, break the bring awareness to Ozempic and Mounjaro today. So I should kind of do a bit of an intro on you, but your background, you want to show it? Dr. Roberta?
Yeah, so my name is Roberta, or Dr. Roberta. I've been a doctor for 10 years. I've worked in general surgery, and currently I do A&E. And earlier this year, I also started doing medical aesthetics and weight management as well.
Nice. What got you into it anyway, before we kind of get into the...
As in into medicine in general?
Yeah.
I don't think that's like a very good answer. But my mum got me into it. My mum's a GP in Hong Kong. I'm originally from Hong Kong.
Nice.
18-year-old me didn't really know what I was doing in life. All I wanted to do was pursue dance. And I think at the time my parents were telling me that's not something you can do for a long, long time. And I thought, well, okay, I'll go to uni then. And then my mum was like, why don't you just do medicine? You got the grades. I was like, okay. And that's how I got into it. I just stumbled upon it.
Do you enjoy it?
I do. I didn't initially, because if the teenager rebellious phase, I was like, my parents pushed me into it. That's not what I want to do. I still want to do dance. So initially I did my foundation training, which is the first 2 years of after you graduate. And then once you got the full license, I was like, you know what, I'm just going to go part-time. I'm going to go dance and then pursue dance, which I did. Like I said, up until COVID. And then that's when I was like, nah, I need another career change.
Wow.
Yeah, lots has happened in the last 10 years.
Yeah, I bet. So the dance is done now, or?
Not quite. So if someone still contacts me to teach a workshop or do a little job here and there, I'll still do it. Always more than happy to do it. But I wouldn't prioritize that now. I think I'll still prioritize my medical jobs now.
Nice, love that.
Thank you.
What brought you to Wales? Well, go on.
So I studied in England, in Exeter actually. That's where I met my husband, and my husband is from Aberdeen.
Okay.
I know.
Nice.
Yeah, so I ended up in Aberdeen, Merthyr Way, lived there for a few years, more than a couple of years, more than I wanted to because of COVID. And then eventually we moved back to Cardiff then.
Wow. I was going to say, I bet you learned the real heart of Wales there.
Yep.
Gone from Hong Kong to Exeter to
it's very, very different.
Yeah, I bet. So now you're back in Cardiff now, though?
Yeah,
Nice.
back in the city.
Nice. How you finding that?
I'm really enjoying it. It's a really good location.
Yeah.
Like I said, I live by the sea, by the beach,
Nice.
in Sully. So it's a really, really nice location. I'm 10-minute walk from the beach, and it's only like 15 minutes into Cardiff, which is amazing.
Love that. What do you reckon of Welsh people?
They're very nice.
Yeah.
I spent 5 years in England studying, and all I can say is that Welsh people just seem a lot more friendly. Like you can go on the streets and you don't even know them, and they're just they'll say hi to you, they'll talk to you, and you can strike up a full conversation. And I like to think I'm quite an extroverted person. I think that works well for me. I don't like because I'm also one of those people that I will see a stranger and I'll say hi, I'll smile. I don't want to feel that rejection, like it's not reciprocated.
Yeah.
But I don't feel that way in Wales, which is lovely.
Good. That's well. Shout out to Wales. Well done,
Yeah.
gang. We're doing it. So today, like I said, I brought you because I put a post out, and a good friend of ours, Louisa, got me in touch with you, which I'm grateful for. And I suppose over the last, it's been brought to my attention anyway, maybe the last 6 months in particular, where I know it's gone on longer, like where Ozempic and Mounjaro has become like a real talk of everything, and it's been so much weight loss going on about it, and I'm just like, I think my mentality is very old school, where like exercise and eating better should be the key components to everything. Still is great. And I have a really weird thought process to it. It's like we're making people weaker.
Okay.
And a sense of like I believe we shouldn't just have something which is like an injection or a tablet and it's gonna like resolve a problem, because in my mentality is we're masking a problem. And I don't get me wrong, like if you are super obese and it's gonna improve your day-to-day lifestyle, go for it. Because you're going to, high chances, you're going to be feeling more confident. You're going to exercise more because you feel good about yourself, and you're going to eat better, hopefully. But if you're doing it to just like look better, and just you're going to just cut corners, I feel like you're going to cut corners in life.
100%.
And I think for me, we've got people then, like, I think about everyone now and I look, I'm like, oh my God, this person looks amazing. They trained really hard. They've lost weight. First thing that pops in my head is,
are they on the jab?
Are they on the jab? And I'm like, that's so bad for the people out there who've been grinding away for years. Like I've been playing sports since I was 7 years old, being tailored to train, like, you know, in the gym all the time and work our asses off for like small percentage of increases. And then we've just got this person now who's just, you know, cut a massive corner and they've looked unbelievable. And I'm just like, I suppose frustrated, but I suppose today I wanted for you to come in and not just hear me vent about it, but I wanted you to kind of give me some education on it, to have a different approach and understand what are the pros and cons of something like Ozempic or Mounjaro.
Sure.
Mounjaro. Mounjaro. I was going to pronounce it wrong.
Yeah, no, brand names, medication names, they are very confusing. If I'm honest with you, I had a very similar thought process before I got into the whole weight management service, really. But we do have, like I said, if we for professionals, healthcare professionals, like qualified people, when we do give out these medications, we have a lot of considerations. We wouldn't just give it to someone with like a normal BMI or someone who's non-diabetic. I am aware you can get it in the black market. You can get it on unregulated sources. You can get it from online pharmacies. You can even take a picture of yourself, put it on a filter, so then you look a lot bigger than you are to fake your BMI to get it. And I think that's more of a drug abuse than using it the right way. I think it's those two medications or any of the weight loss medications are really good if it's used appropriately. So given by a healthcare professional, monitored by them, and then with diet, exercises, building healthy habits, etc. I see the medication as a tool. A little analogy is, let's say if you're learning to ride a bike, you know, when you were kids, like you have those training wheels on the side. That's how I see your Mounjaro, your Wegovy. Mounjaro is basically, Wegovy is Ozempic. That's how I see those injections or any weight loss medication. They are the training wheels. But learning how to ride a bike, that still comes from you. Obviously, you can get a bit of coaching, so you learn how to like live a healthy lifestyle. Yeah. So riding the bike, that's how we see it. And even in the NHS, NHS has a stricter guidelines on who they will provide the medications for. But in general, as soon as you're classified as obese, really, you do qualify for those jabs. Obviously, there are other criteria as well, and you have to be over 18, you're not pregnant, etc. Yeah. And not have certain health conditions as well. But these drugs are not meant to be used by someone who, I don't know, has a BMI of like 25 and they just want to look a bit more cut. It's not meant for that at all. But I am aware there's a lot of people out there that are doing that, and I guess that's partly why I really wanted to be on this podcast, so I can talk about this. And sorry, I keep hitting the mic. Right. So we can talk about this and hopefully spread more awareness about these jabs and medications. Really
cool. So if let's say it then, is it originally designed for weight loss or is it originally for diabetics?
For diabetes.
So what is it, a shortage in the product?
It's not a shortage. It's because of so Mounjaro and Wegovy, which we get in the UK, which Ozempic equals to Wegovy, and all these brand names. Basically, Mounjaro is tirzepatide, so that's the active ingredient in it, and Wegovy has semaglutide in it. They both work on a hormone called GLP-1, glucagon-like peptide 1, and Mounjaro actually has another action, which is a GIP. That's a bigger word. Glucose-dependent insulinotropic polypeptide. Wow. But basically, these two hormones, they stimulate the release of insulin and they reduce glucagon to regulate the blood sugars. As you can tell, because it affects the blood sugars, it was more meant for type 2 diabetes. But they also found out, as a result, you can get weight loss with it. So it quickly turned into a weight loss medication. But it is still very beneficial for people who have diabetes. And it is still not that widely used. It is a common medication for diabetes still.
Wow. So it's predominantly always for diabetics.
Yeah.
But now it's become more of a weight loss.
Yeah.
And it's a peptide.
Yeah, they're both sort of they're both peptides, yeah.
And that's peptides is something our body already produce?
Yes. So both, yeah, so they actually, Mounjaro, it's a receptor agonist. Sorry, without sounding too nerdy.
No, please. I'm all for it today.
So it's more, not encourages, so it attaches itself to the receptors that are already in the body that respond to the GLP-1 and the GIP. And Wegovy is an analog, which is mimicking the hormone the hormone, which is the GLP-1. Cool. Yeah.
Okay. It's mimicking it.
It is mimicking the effects of it, yeah.
So long-term effects, when our body stops relying, like say for instance, what is the normal cycle someone would be on a product like this? How long? It depends. It's like case by case, really. We have people that are on it for like a whole year. Some people are still on it like 2 years down the line, and they're on a really low dose to try and reduce the food noise. That's not something. Obviously, I only started my service in May, so I haven't got these long-term clients yet. But I do have some people who have gone to online pharmacies and then come to me. But I don't think I would be doing anything like more than a year or two, really, because by then you should then be able to develop healthy habits. You shouldn't need it. It's not something you should depend on, really. It's interesting to find this out, and it's because it can go down different avenues. So like you've got the people who are far on the obesity side wanting it, but then say for instance you are cutting, let's say bodybuilders, and they're dieting heavy right now, they're in a deficit, and they're trying to suppress their appetite, then they're doing it in that area, and I just think it can really muck up the psyche, like our psychological like thoughts on like from far ends of the spectrum of what we're feeling. I don't know, what are your thoughts on, like for instance, if obviously you're not going to get the bodybuilders coming into into practice, or
no, because I'll say no anyway.
Yeah,
but they could qualify on the BMI, which is actually, now I just thought about it, that's quite concerning.
They could. How could they qualify? Because
well, hopefully not. In my practice or in the private sector, really, you can prescribe these medications, or you can start these medications if your BMI is over 30. But as you know, BMI is not accurate for people who lift. Like you have great like muscle mass, then that doesn't apply. But that is the guidelines. So I could, in theory, I could have a bodybuilder who's got a BMI over 30, but mainly very muscular, and come to me and go like, I qualify.
Yeah.
But obviously, I'm going to say no to that.
Yeah, you are. But what about the person who's like, by the book, I should.
Yeah. Because then you're also legally, you can't get into trouble for it, really, because on paper the BMI qualifies for it.
So then,
sorry, stay at the conversation.
No, I'm learning. I'm asking questions at the same time. I'm like, I've got a question to ask you, and then my other thought is coming for what you're saying. So like my belief is, right, though, like if say someone's with you for 12 months and you're like, you've lost a lot of weight, you're looking great, what is your diet? And they're lying to you. And then they're like, well, yeah, I'm actually, having good proteins, fats and carbs every day or whatever. And then, but really they're not eating all day and they're eating pizza and biscuits every night.
Yeah, I guess that's the thing. Like we have our monthly catch up and then 3 monthly catch ups. I can only rely on that fact that they are being truthful. Obviously, I wouldn't be able to tell whether they are genuinely eating well. Although I have seen people who literally just live off toast and like on the injections, and they don't have a balanced diet, and then they have other side effects like hair loss, which is also another common side effect. Yeah. I guess if they then tell me they have these side effects, then I can probably more or less guess that your diet is not there. But hopefully none of my clients would go down that route. But yeah, like I said, I think it's just because I think we should all take responsibility and accountability for our own health. If I'm coaching you through your weight loss process and you're going against my advice and you decide to eat pizzas, crisps and sweets all day, that's not really on me, because I've not told you to do that.
Yeah.
That's out of my hands then.
Yeah, you're not holding this person's hand all day.
Exactly.
Every day.
I wish I could, and sometimes I get a bit too involved in my patient's care, but I can't do that. Oh, sorry.
That shows you care too much. Not care too much.
Yeah,
you care
I do.
A lot. But that's a good problem, because if you ever go to like a GP, they're under some time
constraint, yeah, mainly.
And it's like
that.
in, out, so they can't really, they're just trying to solve an instant problem.
That is true. Whereas I have like a whole hour with my patients, half hour, an hour.
That's amazing. To have this energy you have, you're being able to do this for an hour, fair play to you.
Thank you.
Okay. let's just say someone.
Hey everyone, it's Ollie Olds here with a quick word from our incredible sponsor, Pitch Roofer. You know, your home is your castle, and nothing protects that castle better than a solid, reliable roof. That's where Pitch Roofer comes in. They're not just building roofs, they're building trust, community, and peace of mind. Pitch Roofer has been serving our local community for years, and what really sets them apart is their commitment to giving back, from supporting local sport teams to donating to charities. They're making a real difference beyond roofing. Together, we are stronger. Now, if your roof is looking a little worse for wear, or you are thinking it might be time for a full replacement, Pitch Roofer has got you covered with top quality solutions tailored to protect your home and boost that curb appeal. Why should you choose Pitch Roofer? Let me break it down for you. Experienced professionals. These guys know this stuff with years of expertise in residential roofing. Affordable rates, competitive pricing with no hidden costs, high quality materials, durable weather resistant products that stand the test of time. Free inspections, get the condition of your roof checked at no cost. 100% satisfaction guaranteed. They're not happy until you are. So whether it's a repair, a replacement, or you just want a peace of mind your roof is in good conditions, give Pitch Roofer a call on 01656 470016. A text message to 07540 443345 or email gerald@pitchroofer.co.uk. Pitch Roofer, building more than roofs, building a stronger community. Now, back to the show.
Let's just find out now, what are the percentage of women doing a comparison to men?
I haven't got any male clients.
None. Wow.
I think well, I have someone who's inquiring at the moment, but he's not really my client at the moment. I think there's still a lot of stigma surrounding the jabs. A lot of people still think that it's just for women to look slim, etc. It's not for a health reason. I think that's what it is. Or there are a lot of men out there that are doing it without us knowing.
I think it's people buying it online.
Yeah, but even in A&E, when I see people coming in having the jabs and then suffering from the side effects, it's still way more women. This is just all anecdotal, by the way.
Yeah, please.
It's still mainly women, really. Let's say a week, I'd see about 5 people on the jabs from side effects or whatnot. I probably only saw one male patient that's on that once every 2-3 weeks at most.
Really? So you're seeing 5 people coming in for side effects a week?
Roughly that.
Holy
Some weeks there's more.
Yeah, that and what are the common side effects? Hair loss?
Hair loss is common, but because of how the drugs work, they actually slow down your stomach emptying, so it slows down your gut essentially. So side effects like diarrhea, vomiting, they are very common. But they should be really mild though. So if you go to a proper professional to have yourself monitored, those should be very well tolerable. GI upset, and for some reason, a lot of the clinical studies are saying that pancreatitis and gallstone problems are quite rare. Statistically, it's 0.1 to 0.5% of developing them, but that's not what we're seeing in A&E.
You're not seeing that?
No. So I used to be loud and proud about these statistics, and now I'm not anymore.
You've seen a lot more?
Yeah.
Wow.
So since because all these jabs have started since 2023, and there's a lot more patients coming through with pancreatitis and gallstone problems. Again, we don't know whether it's the drugs causing it or whether it was more because it was obesity related, and then now they've lost all the weight and it's all come out. I don't know. I think that needs more research into it. But yeah, we're seeing way more of that since 2023, and these patients all have to go to the surgeons, and not necessarily to have surgeries, but
But then what, as in the body losing weight, obviously it's good for the body to lose weight, but if it's losing weight so quick, what impacts does that have on the body?
So this is why when we those of us who do prescribe the medication, we make sure they're not losing weight too quickly. So that hasn't changed. The general advice is to lose, maximum 1 kilo a week, isn't it? Or half a kilo a week. And that hasn't changed even with the medication. But obviously, if you get it from unregulated sources, you can drop even faster. Sorry, your question was the effects of rapid weight loss, isn't it?
Yeah. This is good.
Well, with rapid weight loss, obviously your body can't adjust to it really. So I think what most people will see is that you end up having a lot more loose skin than you would, because your skin, you're losing elasticity. It's not bouncing back as it should. But in general, obviously losing the weight is still good for you. I guess the question is, if you're losing the weight that quickly, are you building the right habits to lose that weight? And then you would then sort of yo-yo and then come back up, and that's just worse for you.
Yeah, massively. And okay, this is just me, just off the top of my head, is like, what happens if someone's got body dysmorphia, eating disorders, and they don't want to go to you because you're going to say no to them because you might have past history of these issues, but they go online, the black market, and buy it. And no matter how much weight they lose or how good they look, they don't see that in the mirror. They still see that fat person or that bigger person. And I've people who are not even on that, I know I've heard that multiple sources from multiple people that experience. So they're obsessed now, and they're getting validation from everyone in the street saying how amazing they look, and we're chasing that, that endorphin, that dopamine, that all of those aspects. I just think that there's maybe we're plugging a hole right now as a medicine, but we're going to be opening up another issue in maybe 12 years time or 5 years or 10 years time, because these issues now, I think it's going to be another medication to band-aid the gallbladder or the pancreatitis, all of these things. So it's just, I suppose from my end, it's a big fear of...
Same. And that's why I think there should be more regulations regarding who can access these medications. I don't know why it's being treated like a paracetamol right now. I don't understand why anybody who's not medical can just access these jams. These are medications that can drop your blood sugars quite drastically if you self-medicate, or if you just incorrect dosing in general. It can drop your blood sugars. That can make you collapse. And imagine if you're driving and that happens, you can cause massive collisions. And it's just, I'm just thinking the knock-on effects. And so I'm not really sure why this lack of regulation. But I think if we had tighter regulations, we can then prevent these people with body dysmorphia, eating disorders from accessing it. Like I said, you can just take a picture of yourself, put a filter on. Someone who has probably a BMI of 20 can make themselves look bigger and get these jabs. And honestly, that is something that I worry about almost every day, really. But there's nothing much I feel like I can do as just one person thinking it,
I appreciate your thought process on it, because I'm not saying to you, I didn't want you to come in today for me to just attack you.
No.
But I just wanted to have more awareness on it. And it's this is my fears. And I think about it all the time. I'm worried about people in my close network, people I know on a general basis who are doing it. And I'm you got no education behind you on any form of food or eating or exercising. It's just scary to think. And, I suppose if they are listening to this, wake the fuck up.
Yeah, I hope so.
Yeah. What I want to say is I heard something about bone density. Does it impact bone density, or is that just a myth?
I think there needs to be more research into that. Like I said, they have relatively new drugs. But I'll have to come back to you on that. But I imagine it's probably more down to malnutrition, really. The drugs directly shouldn't affect bone density per se. But if, let's say, you're not having a balanced diet because it suppresses your appetite, you're only able to eat very small portions, and if it's not balanced, you're not taking supplements, dropping your weight too quickly because it's not monitored, then I can see how that can happen.
And if people are not eating, nutrients or good food, and how it's impacting, because the appetite's suppressed. They're never is it they're just not hungry? Because I can eat all day if I wanted to.
Yeah, me too.
so it's a fight for me not to, but I know I've got to not do that. Or
it's because the medication actually, like I said, it mimics the GLP-1, isn't it? And the GLP-1 actually slows down the stomach emptying, so the food actually stays in your stomach for longer, so it's physically there. So when you're full, you're not going to want to think about food, and after a big meal, you're not going to think about, let me go for a dessert. A dessert, yeah. If you're genuinely full, you wouldn't then suddenly think about it.
Hang on, I don't know, because if you have food and you always find room for dessert.
That's true.
I always find room for ice cream.
But there's only a limited amount of it, isn't it?
100%.
You're not going to go for another meal.
No,
you're not going to go for 3 desserts. Maximum 2, I've done it before. And that's also not something that you do every day either. Yeah. So in theory, that is what is meant to happen. Sorry, what was your original question about?
The question was about if you're not having nutrients. Oh no, the suppressing your appetite.
Yes. It does. So, and it then triggers different releases of different hormones to make you not feel hungry, basically, because there's the hungry hormone called ghrelin, and it reduces that really. So in theory, that's what people call it. Reduces the food noise, which is like the urge to eat even when you're not physically hungry. And a lot of people stay on that long term ish on a low dose to reduce the food noise, which I think can be managed in here. Really, it doesn't have to be from a drug.
100%. Like, and I think that's where I'm going back to the mental resilience aspect of doing hard things creates an easy life. Doing easy things creates a hard life, and we're band-aiding things. But I want to say though, if you are legitimately obese and like this has got you into going to the gym, feeling better, looking better, and you're eating better, like sell this to people and really buy into it. But I just feel like everyone else I'm coming across ain't in that aspect of that line. And
I think the majority aren't like that. But obviously, on the other extreme, we've had a lady in her middle age-ish, let's say middle age, 50s, and she was really, really big, and she was struggling to walk. She was getting arthritis, knee arthritis, and probably everywhere else as well. But it's the knee that was stopping her from walking. Once she's been on the jab, her weight didn't drop massively, but as her weight was dropping, she can now walk around the block. She can get more walking in, and then like her whole life has just gone up really because of it. So I do think it's great for people who do need it, and as in genuinely medically need it, not, I need to.
And what other effects then once let's say I stopped, I'm not, but I mean, if someone stops taking it, what happens to your appetite then?
Your appetite will naturally go back to normal.
Normal?
Yeah.
It doesn't increase anymore?
It doesn't increase anymore. Normal as in your baseline, it just goes back to before you were taking the jabs.
So your head noise will increase though? Or would it be back to original head noise?
But then hopefully by then, once you've completed the whole medical journey of your weight loss, hopefully by then you would have built healthy habits and also mental resilience as well to learn different strategies to go against these food noises. We all have the food noise, just to different amplitude, isn't it? Like I said, I haven't got such long-term clients yet, but I imagine for some of them, when I taper them down, you don't actually need to taper them down. You can just stop really with either of these two jabs, but you could just taper them down so then they get a bit more used to, this is the food noise coming back a little bit now. And then next month you drop it again if they're coping, and the food noise is coming back a little bit more. But then because they have these strategies in place, they are more disciplined, they're more resilient, then they don't need to rely on that physical food noise being reduced by the drug, if that makes sense.
Definitely that makes sense.
What's up, guys? This podcast is brought to you by UTest. UTest provides clinically accurate, rapid home testing kits for a variety of medical conditions and deficiencies. Designed for convenience, these tests deliver results in just 5 minutes, eliminating the need to wait days or weeks for lab results. The range includes tests for prostate PSA levels, bowel cancer screening, onset menopause to fertility, and more. All tests are available with the next day delivery at www.utest.co.uk. Use the code 0010 for 10% off your order. Now, let's go back to the episode.
What have been your worst cases that you've come across in A&E?
I guess apart from the pancreatitis, which is, like I said, again, don't know if it's related to the drugs. I've had someone who came in with D&V, like diarrhea and vomiting. They've had quite extensive bowel surgery, and they've had one of their kidneys removed because of a malignancy, because of cancer. And then they were sourcing it from TikTok.
What the fuck? TikTok education.
Yeah.
Oh my gosh. That's the society we're in now, though.
But the problem is, like I said, if you get it from a black market or online or whatever sources it is, I don't know if that is genuinely the medication. So that's just what they tell you, that this is Mounjaro, but I don't know how much of the tirzepatide is in it. So yeah, I don't know if it is genuinely that causing it. They were okay because we admitted them for a couple of days. Had some IV fluids, intravenous fluids, and they recovered. The reason we knew that it wasn't an infection causing is because we took blood tests and they weren't around anybody with the same symptoms, and also because they weren't showing any signs of infection. So we thought it's probably more to do with the weight loss jab, really. They recovered, but I told them you need to go to your local weight loss clinic where there is a healthcare provider that is monitoring you, especially with such extensive history. Like they had heart problems, like blood pressure problems, everything. Like I was like, you should not be self-medicating. This is not it's not an ibuprofen, it's not a paracetamol, you know. That's probably one of them. And the second one that I came across was a young girl. I can never sort of like eyeball people and just guess their BMI, but she is normal BMI.
What is normal BMI? Because I don't really...
20 to 25.
20 to 25.
Yeah,
okay.
but like I said, it's not really an accurate measure of because it can be changed by your muscle mass and things like that. So this girl, it's definitely normal BMI. She's quite healthy, to be fair, no medical problems. She got Wegovy online. Don't know where from, I didn't really ask. And she got herself 5 times the dose than she should have had. So she doesn't qualify for the meds anyway. And then secondly, she gave herself 5 times the dose, which is technically an overdose. Luckily, it didn't drop her blood sugars, I guess just because her body is young and she's compensating because that's what your body does. So I'm glad nothing wrong really happened to her. But yeah, things like this just scare me. And I'm just like...
5 times over the amount.
Yeah. And there's probably loads of people out there that are doing silly things like that. And because the side effects is not even the side effects, but it's not caused such a detriment to their health. They don't come into A&E. They just, it's really worrying.
Because they're getting thrown out like paracetamols to people, though, they probably don't understand this seriousness of this. And they're just like, oh, well, if I can just get this offline, it shouldn't be that bad. So I'll just inject a bit more, or I'll take a bit more than the average. And before you know it, you're in that rabbit hole end of more.
And the thing is with blood sugars, like if you're not diabetic or you've not been trained to, diabetics would feel it when your blood sugars drop. Like if it's me and you, when our blood sugars drop a little bit, we probably wouldn't even feel it. And if you're constantly running on a low blood sugar, your body gets conditioned, like you get conditioned to it as well. And then you don't even realize that it's low. And then suddenly you've overdosed or self-medicated and it drops but drastically. You just collapse and lose consciousness, and that's it. Like you wouldn't even know. It's scary. It
is scary, and I'm grateful for you sharing all of this. I'm just looked online on a few things and got trying to get some research on it. But so the difference regarding Mounjaro and Ozempic for individuals with eating disorders. So disordered eating patterns for those with anorexia, bulimia, or binge eating disorders. The appetite suppressing effects of Ozempic and Mounjaro might trigger or worsen disorders eating behaviors. Both drugs work by reducing hunger and slowing gastric. Emptying, which can lead to unhealthy weight loss and reinforce restrictive eating behaviors. Long-term concerns: people with eating disorders may struggle with the idea of maintaining a healthy weight. A medication like Ozempic and Mounjaro can heighten feelings of guilt or anxiety about food. These drugs can make it more difficult to cultivate a healthy relationship with eating and food choices. Where did I put it on earlier? The side effect? What was the side effects I was looking at earlier? Impacts of fertility and reproductive health. Would this impact people wanting to have children? Because it's a peptide knot.
Yeah.
I know we asked and you said it hasn't been enough information.
Yeah, there's not that much research on it. Usually we do tell people if we start you on the weight loss jabs, you have to be on 2 methods of contraception. So either like chemically, as in taking a pill, or the depot injections and a barrier method, or just however, you just need two methods really. But this is not one of my patients, but I have heard that somebody just got pregnant even with that really. It can happen. So I don't know whether it really truly affects fertility. Well, obviously nothing is bulletproof. You can have 2 forms of contraception and still get pregnant. So I don't know. But then again, that is one case. So I don't know how it would then affect fertility if you can still get pregnant on it, really.
So, it's I think if there's not enough information on it, I think if you really value wanting to have kids one day,
you wouldn't even be on it then if you are genuinely trying, really.
I've just looked at now. So Ozempic
mechanisms, like you've said, GLP-1 receptor, but the pros effective in lowering blood sugar levels, significant weight loss observed in many patients, potential cardiovascular benefits.
Yes, especially with Wegovy, which is Ozempic, I think. Anyway, with semaglutide, it is. There's a study called SELECT trial, and this was done in 2023, which is about the time when it was introduced, all these jabs were introduced. They have shown, it has shown that with semaglutide, there's a 20% risk reduction in any cardiovascular events, or like heart attacks and things like that. Wow. So yeah, so that is good for that. Massive. Yeah, 100%.
The cons though, I mean, which you've already but you spoke about them more, so I'm just kind of talking about them. So common side effects include nausea, vomiting and diarrhea, potential risk of thyroid tumors observed in animal studies, it's saying you there.
So we don't, so that's one contraindication that we don't give the jabs to, is if they've had medullary thyroid cancer before, or if they got a condition called MEN2, is, hang on, big words again, multiple endocrine neoplasm type 2, and this is where your body can basically just have tumors in your thyroid, your parathyroid, and your adrenals. So we can't give it to patients like that. But we always check that they haven't got these conditions. They don't have this thyroid cancer, they don't have this MEN2, and they're not pregnant or breastfeeding. So we always check that, really.
And the last two, discontinuation can lead to weight regain, obviously if they haven't built in healthy habits.
Yeah.
And the last one says may cause Ozempic face due to rapid weight loss. What's Ozempic face?
Yeah, the famous Ozempic face. It's just a weight loss phase, really. If you lose weight drastically or very rapidly, like I said before, like your skin can't catch up to it. So you end up having loose skin, saggy skin, and you haven't got the fat to support it, really. So that's what we call the Ozempic face.
There's a droop then, it would be essentially if your skin's got like lost all of that.
So for your face to have volume, there's a lot of fat pads in the face. This ties into my other job now. And as we age, obviously the fat pads, they do come down, but because for a generally bigger person, if they have a higher body fat percentage, or their face will be more plumped before, and as well as their skin, they'll be more stretch or more plumped. Yeah. And obviously, if you suddenly lose all that weight, your body hasn't adjusted to it. You've lost all that fat in the fat pads on the face, and then your skin hasn't adjusted to it. So that's what it looks. It looks like it's a droop when it's not really a droop, if that makes sense.
Gotcha. Yeah. Okay. Well, it's
an illusion.
And now Mounjaro, we've got dual GIP and GLP-1 receptors, which everything you've just covered, which is great, improves insulin sensitivity and reduces appetite. Mm-hmm. Approved by type 2 diabetes, also used off-label for weight loss. Pros: more potent in reducing HbA1c levels. What's that?
HbA1c level is how we diagnose and monitor people with diabetes. It's basically showing how much, again, not trying to get too nerdy into it, your blood sugars attach itself to the HbA, which is the hemoglobin, which is the red blood cell in the bloodstream. And this blood test actually measures how much sugar is in the blood, physically in the blood. Right. Which I think is a really clever thing to test for. HbA1c measures how much sugar. Did you say how much sugar is in the blood? Is that what you said? How much sugar is attached to the sugar molecule is attaching to the red blood cell, basically. Okay. And how much? This is me just asking, like, what are we meant to have in our red blood cells? Like, how much sugar is it meant to attach to all of that? So I can't remember the exact value, because obviously in A&E I rarely do this now, and also I'm not currently offering blood tests yet in my private clinic. It should be double digit, but if you have someone, I need to read up on this. I should know this. If it's a high HbA1c, which usually your GP would test for, then they can then move on to considering, is this a diabetes really? Okay, cool. I'm glad you told me, because that's just gone in, and I'm trying to process and understand what that is at the same time. So like that part there, and where it goes levels compared to other GLP-1 drugs. The pros: significant weight loss benefits, potential to reduce breast cancer tumor size in animal models. So they've done the tests on animals, which is noticed they've had potential to reduce breast cancer tumor size. I don't think that's been tested on humans yet. As in, that's not something we've found in. No, saying that in animal models. So I mean, potential. Need more research in that for sure. I'm just someone's gone and like, I hear this and I go, shit, I'm gonna give this a crack now.
Don't do it, guys. So common side effects include nausea, vomiting, and diarrhea, which we've talked about. Risk of pancreatitis and gallbladder issues.
Yeah.
And abrupt discontinuation can lead to intense hunger and rapid weight regain. Depends if you're coming off this correctly.
Yes. Obviously, it's not like unsafe per se to stop it. If someone has too severe, like too many side effects that they can't tolerate, then sometimes the dose reduction might be better. So whatever they were taking before, if they were if they're still losing weight reasonably reasonable weight on the previous dose, we'll then reduce it. But if, let's say, it's just too much for the body to handle, and if the patient rather just stop it altogether, they can. It's not going to do too much harm. But if the higher the dose it is, we do generally taper it down. So then, like I said, your body can adjust to it. Mentally, you can adjust to it. But ideally, obviously, once you come off the medication, you will gain back a little bit more weight. But like I said, hopefully by then you would have developed healthy habits to not have to regain a little bit is fine. But we're not saying going back to where we started.
Yeah, got you. Okay. It's interesting. It's really interesting. And I suppose, first of all, like the root of all of this, the first thing you'd be saying to people is A, are you exercising? B, are you eating better, right? Drink water.
Yes. And I probably go too much into detail. Most of my consultation is more surrounding that, really. Yeah. I definitely analyze what their lifestyle is like, what they do for work, like how physical is their job. Outside of work, like what is your schedule looking like? I probably go too much into detail with my patients, to be honest. And then like, what's your eating habit? Like, do you skip your meals, or like do you eat a big meal like at the end of the day and then you end up snacking, like things like that? And then, like, do you do any sports outside, or have you got any other health problems? I take like a full-on medical history and do everything really before I then even suggest, like, maybe we could try the medication. Yeah.
How many people put it on you straight away when they come in your room?
What do you mean now?
Like, how many people go, look, I just want to get on Ozempic, or
everyone?
Yeah, you're like, hang the fuck on.
Everyone.
Yeah, wow.
Because even in A&E, obviously, sometimes when I see patients and I give them advice, like, okay, this dose is too high for you now. Maybe you should drop it down. But like, contact whoever is prescribed for you, or if you haven't had anyone prescribed for you. Yeah. So it is hard, because a lot of the times, but by the time they click that button to book that consultation with you, they want that jab. They don't want to be told that you're not having the jab. Yeah. I haven't so far turned anybody away, but it's because they all qualify for it. But yeah, I'm sure one day I'll see somebody who's booked in and just expect to have the jab and not be happy with me. But that's just part of the journey. It's a no, then it's still a no if you don't qualify.
Good. I'm glad. Well, the thing is, the people who don't qualify will just go online and get it.
I know. Then that is another,
So like, if you're not going to do it,
I know, and I know they'll go somewhere else to do it.
And like the fact that it's so accessible, why do you think that is? Like, it's because I personally, just listen to it. It seems like a great money spin off for the big pharma type of people who are selling this product. It is. They're rolling in it.
I genuinely don't know, because it is, like I said, it is a prescription only meds. Yeah. Actually, GPs can start to prescribe it soon. There are restrictions, like only for diabetes and other comorbidities, and their BMI has to be over 35 instead of 30. But yeah, I am not sure. It's probably because it is a good money making business.
Of course, yeah. It's a bit like, have you ever watched that series in America? And they're talking about is it opioid? What's that big drug?
I haven't seen it.
What was that big panda? It's like basically something that people take. There was like a step off from heroin, but it was like getting sold to help people with like pain, and they were just giving them like a lower form, but it was addictive. What was it called?
To be honest, all the
pandemic in America.
Yeah, all the opioids can be addictive, really. Yeah. If you use it for long enough, it is one of those.
I'm trying to think, it was a great episode. I was hooked on it, just seeing it, and it's a true story. It's true based on obviously in America.
Yeah.
I'm gonna ask you a few questions from some of my Patreon listeners and members. Yeah. So I'm gonna ask them. I'm gonna find out what they got to say, and I've screenshotted it. So some of them I can't say because some of them have gone hard on the question, and swearing a little bit.
First always of all, beep it out.
Yeah, beep it out. So one of them just said, which we've already discussed, was, should I be on it with ADHD?
That I don't know. I currently haven't got anyone on ADHD meds, but it's not necessarily like contraindication. Obviously, you gotta. I hope whoever is on ADHD medication is going to a proper qualified medical professional to have, this whole process monitored.
Perfect.
Yeah.
Another question, and we've kind of discussed this, but is it true it makes your bones less dense?
Perhaps not with the actual drug itself, so it could be more related to the diet side of things. And if you're not having a balanced diet and not taking supplements, then potentially that can cause a reduction in bone density potentially.
I think everything we're going to go through right now has been touched on. Like the questions I'm going to ask you, again, we've already touched on, but
sure.
There's another one. What damage are people doing using these? People just straight away instead of diet. People using it straight away instead of dieting, essentially.
That's the thing. We aren't meant to use the drug on its own. It is meant to be balanced diet, move more, be more active, and then eventually build into exercise, really. And then these are the training wheels for you to learn how to ride the bike, for you to build these healthy habits. So it's not meant to. So you should never use the weight loss jabs without sorting out your diet and getting more active, really. Okay.
Another one is, and we've again discussed this, does it stop fertility? Which we've kind of discussed. It's not essentially going to stop fertility, but it's...
No, because you can still conceive on the jabs. But the reason we don't want people to be pregnant or breastfeeding on it is because there's not enough studies to say that, like, what harm it could do, or is it harmful? Like, we don't know. There's not enough data to show that. So that's why we always say, just take contraception. So making sure you're not trying for a baby right now if you want to be on these jabs.
What happens if you were on something like the pill and Ozempic or Mounjaro? Like, because the pill's quite chaotic as well for a woman.
Oh yeah, your hormones will go like...
Yeah, that's what I mean. Like, there's some women who refuse to take the pill because of what it does to their hormone levels prior to this. So
there's no... So I don't think it's a common side effects that with Mounjaro or Wegovy that it affects your mood in that sense. But yeah, the pill, it's known to do that. That's absolutely okay. You can be on the pill and the Mounjaro. But we always advise adding another form of contraception because, like I said, the pill isn't bulletproof. And I've heard someone got pregnant from that.
Have you loads of people who got pregnant?
Yeah, exactly. This is why I don't think it necessarily affect your fertility like that.
Okay. And why do some people get prescribed Ozempic and why do some get prescribed Mounjaro?
Depends on... They're both really good. So... Mounjaro, which is tirzepatide, is essentially more effective in terms of weight loss. So it depends on what they're trying to achieve. Sorry, without me steering off. But like I said before, with Wegovy, it has a much better effects on the heart health. It reduces the risk of having any cardiovascular events, major heart events. So that would be better. So Wegovy, which is semaglutide, which is Ozempic, it is better for people with heart problems or anything that can feed into the heart problems. But if we're talking about, and also it depends on how people respond to the drugs as well. Some people respond better to Mounjaro, some people respond better to Wegovy. Yeah. But the data is showing that with Mounjaro, with the lower doses, like up to 5 milligram, you can actually get about like 15% weight loss. Whereas compared to Wegovy, to get that 14% weight loss, you have to go all the way to the maximum dose, which is quite high, and then it gets expensive. So financially, people also consider that as well, because Mounjaro is actually slightly cheaper in the whole cycle, whereas Wegovy starts off cheap and then it shoots up. So those are things to consider, really.
Interesting. Okay. One of the guys said, "All a bunch of lazy beep risking their lives to take that shit. Just eat healthy and go for a walk."
To be honest with you, he's not wrong.
I know.
He's not wrong. He or she is not wrong.
He's a legend.
I actually do know somebody, one of the nurses I work with, and she's done it without any jabs, and I'm like, I just love, love seeing her journey, because I've seen the whole weight loss, the change in her, lifestyle. Like, she eats healthy and she's very active now. She's like a different person. Amazing. And that's slight steering off the conversation, but people don't believe that she's done it on her own. Like a lot of people think that you must be on the jab, but I genuinely think you can do it without the jabs. I think it's just, like I said, those are the training wheels. It helps you, give you that little oomph. It's just a tool to help you, but you absolutely don't need it. If you can do it without it, that's great. Like, amazing. That's like, but that's round of applause.
The thing is, like you just said, it takes the credibility from someone who's just done the work, and really worked their ass off and lost the weight. Now, again, I don't want to, the people who are on the obese side and it's getting them the training blocks on to do it, amazing. But if you're not in that area and you've just worked your butt off, good on you.
Yeah, exactly.
And everyone else should be in that same category as well. If you're not in that area, but
and you should be congratulated on doing that just on your own, really. I love that.
Last question. How do you feel about this being prescribed by non-medical people?
What do you mean by non-prescribed? What do you mean by prescribed by non-medical people?
I'd assume they mean by buying it offline, because if they're not getting it from a non-medical person, they wouldn't get prescribed it, would they?
So my knowledge in this area is quite limited because I've never engaged in this. This is just what I've heard from patients I meet in A&E and patients in clinic. Apparently when you go online, you know, like you do a little questionnaires, you answer a few questions, you upload your photos and videos or whatnot, you end up talking to somebody who is a prescriber. But obviously you never really get to see the face. So I'm guessing the person who is prescribing these remotely or virtually or indirectly, they are medical professionals. But it is quite concerning that there would be any medical professionals that are considering even doing that job. Because I would never put my...
Yeah, your integrity is a...
Yeah, I would never do that. Like, not online and... Yeah.
I think it's pretty messed up, the fact that you can edit a photo, put it online, send that out, get AI to tweak it, and then you're in the same category as those people who legitimately need it. That, for me, just... That's the wheel we're in.
This is what I mean. We need regulations in place, and things are happening slowly, I guess.
It's been a really interesting episode. I'm grateful that you come on, and I know I've grilled you a bit.
No.
But there should be more people like you, because you are literally doing the main questions and work to go, right, you legitimately need it or you don't. Now, this is my belief on it, right, is, and you can tell me if it's wrong, and please do, so my thoughts are, right, let's say I take it, and I'm not obese, I just take it because I want to lose weight, right? Let's say I am a big guy and I've done it to lose weight, but I've lost that weight, but my belief system is I'll only lose weight on this medication. Like in our subconscious mind, we still have the story of ourselves still being that fat guy, but and like all the past experiences from that. Now, if I don't change those areas of my subconscious of what I actually feel about myself and the belief systems I have, then I'm always going to feel like I need to stay on this to a level of maybe microdosing it to forever feel good enough.
I think a lot of people are like that as well at the moment.
And I'm worried in particular for women, because like you just said, the percentage you have come through your door is women. I know comparing yourself to others kills your own momentum and confidence. And you see this woman who's just lost X amount of weight in that period, and you're busting your ass all the time. You've still got that bit of fat on your hips, or that cellulite, or this, that, and the other. And you're like, oh, you know what? I could just do that, and this will solve my problem. But that belief system is, you're still that person in the mirror. You're seeing the same old you. Do you know what I mean?
Yeah.
And that's what I'm scared of.
Yeah, you've just unlocked a new fear in me as well.
Yeah, because we're not changing. We're changing superficial.
Yeah.
This is our skin, right?
Yeah.
But it's what's going on internally.
I understand.
Our belief systems.
That's why I think sometimes I'm not at that stage of my career yet. I do want to have like a whole team to run a full weight management service that deals with, like, you know, get a PT on board, get a dietitian on board, and also get like someone like yourself, like a life coach in, or some sort of like someone who's got like a psychology background to because I do think weight management isn't just about losing the weight. Obviously, losing the weight makes you feel better physically and mentally, but I do think there's a lot of work that needs going on in there as well. So I do think one day if I can develop a weight management service that can target all these areas, so then your inner self and what you're seeing in the mirror, they match up. And yeah, hopefully that will change your mindsets and your inner beliefs and things like that.
Definitely. And like, let's just say right now, you know, what's a lot of people's coping mechanism when they're stressed out? Mine is
Eat.
food. Mine's food.
Same.
So like, if we haven't changed this belief system underlying that, and we get off the medication, and life is always going to throw stresses at us, but we need
And
to
then
have
you're
the
not going to
tools.
bounce back to eating.
Yeah. Because we haven't had the tools, the underlying things to work on these areas. We've just band-aided it. And that, I suppose, even going down the area of like, nothing wrong with people taking antidepressants if it's like you need it and it's something really tough going on in your life. But doing the work as well is just important.
I understand.
Otherwise,
of course.
we're forever on them.
Yes.
But that's another story which we don't have to get into today. But yeah.
No, I completely agree. I do think that modern medicine is great, like, because they give you the opportunity to have like these medications and whatnot to assist you in life. I think of them as an assistance, really. But yeah, it teaches, not really teaches us. It does make us a bit lazy sometimes. Instead of like doing some inner work, you then rely on medications. But it's the same thing happening with these weight loss with this whole fame of the weight loss jabs as well, to be fair. Yeah, a lot of people are not doing more work on themselves and then just relying on chemicals and meds and things like that.
Because it's a quick fix, isn't it? Right?
It is, yeah. And a lot of people love this quick fix.
Yeah, well, of course, it's easy.
Yeah.
I don't have to do the work.
Yeah, and you get to the same place.
Instant results.
Yeah.
But it's like, I don't know, I just think that the best way of doing stuff is normally the longer journey with the better benefits, and they're sustainable, and, you know, go for a walk, eat better, drink more water, sleep well, journal, write your thoughts out, get around good people.
Yeah.
You know what I mean? Like that alone. Read a book in it or chuck a podcast on.
100%.
But anyway, I'm going to divert even more on that. But your conclusion on everything we spoke about right now, Roberta, what would be your last message to people?
My last message is something that I always say, even on my social media, is to please go to a medical professional, go to a qualified healthcare professional for any sort of medical weight management, or even if you're just considering, just book a consultation, and a lot of them are free, and have a chat and do it through it, you know, the appropriate way, and don't get it on the black market.
Love that. How can people find you? If they're going to go down this path, I want them to do it legit, and I want them to go to you. How can we make that happen?
So you can find me on Instagram, even TikTok, at rtb.aesthetics. I also have physical business cards as well, for people that I do meet.
Nice.
But otherwise, social media is probably the best way to get hold of me.
So if they want to try and get like a consultation with you, that through social media?
Yeah, so I have a booking link on my social media, so they can always go onto my Instagram, go onto the booking link, book a consultation with me.
And what's your Instagram called?
At rtb.aesthetics.
At rtb.aesthetics. And you do aesthetics as well then?
Yeah.
Hey.
That's just like my little business page. So I do aesthetics and my weight management clinic in the same place, really.
Amazing. Well, I'd love to do potentially more work with people. If they're listening to this right now, we can just send them straight to you.
Thank you.
And you can do the work.
Thank you.
Something I always ask my guests is, what are you grateful for?
That's a very difficult question. I'm a very grateful person about everything. I am quite religious myself. I'm grateful for all the opportunities that God has given me and all the people that He's put around me, really.
Nice. Love that.
So everything, really.
Love it.
Thank you.
Well, I'm grateful for you coming on, bringing the amazing energy.
Thank you.
Being so knowledgeable and really being open and vulnerable to share everything and anything.
Thank you.
And I hope more blessings go your way.
Thank you very much. It's been a pleasure. Thank you so much,
Take
Ollie.
care.
Thank you. You too.